There are some things on tax reform that I think we can work with the administration on. I think there are some other things in spending control we can work with the administration on. My point in saying this is we need to get some things done if we want to get this economy going again, and if we want to prevent us from getting a double-dip recession. But at the end of the day, there is a big difference in philosophy at play here. And I just want to be as candid with you as I possibly can be about what I personally think as your representative is the way to go. And that's why I do these meetings. That's why I tell you who I am, what I believe in. And that's why when I go to work for you in D.C., as I do on average 4 days a week, I'm pushing ideas, passing legislation to try and fix this problem. With that, I want to thank you for your indulgence, and let's just have a conversation. Is it Vanessa and Allison? Okay, so how about Vanessa, how about the guy in blue here? And then Vanessa, how about the lady in the purple and black?
Hello, Mr. Ryan. My name is David. I am a kidney transplant patient. I have a filtering system disease that there is no cure for. I didn't ask my kidneys to fail. My immune system is suppressed due to the many medications I'm on. When I become ill, it takes me a very long time to get better. I may look healthy, but you're not my body. I rely on Medicare and Social Security for my livelihood and my medications. Without my medications, my kidneys would fail and I will die. I'm 53 years old and your plan does affect me. I worked for 25 years contributing into the system. I know your plan will not help out the millions of people under 55 who, through no fault of their own, have to rely on Social Security and Medicare. I could not survive on the proposals in your policy. If they are put in place, you may as well put a gun to my head. I want you to support the President and keep Medicare and Social Security the way it always has been. It is the right thing to do. If you have any compassion within your heart, put yourself in my shoes and help me and the American people in my predicament. This is the wrong way of saving money. Mr. Ryan, actions and deeds speak louder than words. No private insurance company will pick me up if I'm dropped with my pre-existing condition.
All right, thank you. I got good news for you. I've got good news for you. Thankfully, what you said is not correct. And I mean that in a sincere, kind way. The proposal we passed, you're staying in the traditional Social Security system. If you're on Medicare today, whether you're under 55 or above, because you have end-stage renal disease, you stay in the current system for the rest of your life. So that doesn't change that. Number one. Number two, even if you're 53, it doesn't matter. You're grandfathered in the current system, even if you're under 55 and you're on Medicare today. So that doesn't change that. Number two, with the under 54 population, I'm not talking about the exempted population like yourself, an insurance company can't deny you. Under what we propose, they have to take all people. They cannot deny you. It's just like what I have as a federal employee. It's the same system. Federal employees get a list of plans to choose from. They're guaranteed coverage options. You pick among those plans, and they cannot deny you based on your health condition. And if you have higher health care costs, you get more of a subsidy to protect your premiums. That's what we propose for the future. So under either scenario, you're totally protected. And under your scenario, you stay with what you have right now. Now, you mentioned the President in keeping Medicare alone. Don't forget the President's new law dramatically changed Medicare. I mean, I think a lot of people forgot this. But the President's health care law dramatically rewrote Medicare. It took $500 billion from Medicare to spend on this new health care entitlement. I mean, how many times he said, stop raiding the Social Security Trust Fund to spend Social Security dollars on other programs? His new law began that process with Medicare. But the second element of his Medicare changes that I think, which we repeal in our budget, I think is even more worse, it's called the IPAP. Starting next year, there is a board of 15 people that the President appoints to be in charge of Medicare. This board now has a global cap on Medicare. Just so you know, Medicare is now forever changed because of the President's health care law. Before, there was no cap on Medicare spending. Now, with the new law, there's a cap on Medicare spending. And the board is designed to come up with ways of cutting reimbursements to providers to get Medicare to live within the cap. The President's latest reform is to double the cut in the cap. So he is saying, we estimate about $500 billion in the healthcare law to reduce Medicare payments by. Now he's saying double their quota targets to hit cuts, and that's about $1 trillion, which what bothers me most about this board is I don't think it's constitutional, because they get to do it without congressional consent. The board, basically, of 15 people who are unelected, appointed, unaccountable, they decide how to get those cuts out of Medicare by squeezing down providers. And what the Medicare chief actuary is now telling us, I'm on the oversight committee that watches the program, is that by the end of this decade, Medicare providers will be reimbursed at rates less than Medicaid. Well, Medicaid pays about 60 cents on the dollar to providers, and that means Medicare is going to the position of paying healthcare providers about 60 cents on the dollar, and then according to the president's chief actuary at Medicare, it goes on down to about 30 cents on the dollar. And so what this new law that is in place that the president passed will do is it will just encourage more and more Medicare providers just to drop Medicare, to stop taking Medicare patients. I really think it will collapse the healthcare system, and especially the Medicare system. What we're saying is get rid of that. Stop raiding the money and keep that in Medicare to make it more solvent. Get rid of this board and don't impose these price controls on providers, because every time we've tried that, and the government's tried this before, all it does is it runs providers out of business. Nursing homes go out of business, hospitals will stop taking people, doctors don't take Medicare anymore. That's the path that the new law has us on that I think we should get off of. You have a very unique healthcare condition I'm very familiar with. And that is a healthcare commission that the federal government basically stepped up and said, let's cover this disease because there's no way private insurance can cover this. We learned a lot about end-stage renal disease. And that is this. There are some people in society who, through no fault of their own, you're a perfect example, get hit with an unpredictable, extremely expensive illness. What I personally think we should do, I'm talking about under 65 as well, and this is about 8% of our population of the under 65. That is what drives up a lot of health insurance costs, because a pool, say a small business has 60 people, somebody gets a disease like this, everybody's rates go up. What I think we ought to do is have subsidies just to cover those costs. I call them risk pools. High-risk pools at the state level to make sure that if you're a person that gets into a situation like this, you get breast cancer, you get prostate cancer, whatever, that you have high-risk subsidies that kick in to prevent you from going bankrupt if you get this kind of an illness, that keep your premiums from going up too high. But more importantly, what you do by channeling your subsidies to those people with those pre-existing conditions is the rest of the 92% of the American population under 65 who are paying really high healthcare costs, you dramatically lower their healthcare costs because you take away from the pool the chance that somebody can get really sick and crank up the cost of that healthcare pool. So by capping the cost of insurance for that 92% of the population, you can dramatically make more competitive and lower the price of insurance for that 92% of the population. And as society, we can target our money a little more effectively to the people who need it the most, who are the people with pre-existing conditions. The lady in the purple.
Hi, Congressman Ryan. First of all, I want to apologize for the rude treatment that you guys received.
It used to
But it embarrasses me, and I don't think people should be that way. Number two, I want to say, before I ask you the real question, is that I have written to Congressman Ryan and called him several times. He has always responded. If you hear something that, like this gentleman, that the Obama's health care program did a certain thing and Congressman Ryan's isn't, I would suggest before you believe what you read that you actually write or call Congressman Ryan, because there are many things out there, and I think Congressman Ryan and his budget is a real threat, or are a real threat to Obama and his crazy spending, if that's the way I feel. Now, my question is this. On the way you showed the debt going up, we have another year of this administration, and you said you hope that we can get something done between the Republicans and the Democrats. However, if we can't, can we sustain this? I'm wondering how close to that 100%, we're at 100% right now, you said.
On gross debt, yeah.
Where will we end up if we can't get an agreement with this tax spending and spending cuts and tax reform?
Yeah, that's a question I try to get an answer to quite a bit, which is when will the bond markets turn on us? When will